important topic from unit number 4, thyroid and antithyroid, the drug which are act on endocrine system. Most of the steroids are acting on this endocrine system, but it is one of the drug that is thyroid and antithyroid. So thyroid are the agent which used in treatment of hypothyroidism, and antithyroids are the drug which are used in treatment of hyperthyroidism. Now there are two hormones in thyroid gland that are present which showing their action are T3 and T4 hormone. As name indicate, T3 hormone that is triiodothyronine and T4 hormone is thyroxine. In T4 hormone, that 4 is stand for the 4-iodine molecule in thyroxine structure. Now thyroid gland is a functional unit through which these T3 and T4 hormone are released, which may contribute their action in hypothyroidism and hyperthyroidism. In hypothyroidism, these hormones are not that much amount released, and in hyperthyroidism they are released in much amount. So as we go through the structure of thyroxine, that is T4 hormone, the 4 iodine molecule are attached to the tyrosine basic nucleus. The tyrosine is nothing but the amino acid. The tyrosine at the third and fifth position 2 iodine molecule, and at fourth position the para hydroxyphenoxy group is attached, to which again at third and fifth position these 2 iodine group are attached. That's why name given thyroxine T4, means this 1, 2, 3, 4 iodine, and in triiodothyronine 1 iodine group at this meta position is absent. Okay. In case of the hypothyroidism, that much amount of T3 and T4 is not released. That's why the thyroid gland is going to be swell. That condition is also known as the goiter. And in case of the hyperthyroidism, the excess amount of T3 and T4 is released, which causes the shrinkage of this thyroid gland. In normal case, the thyroid gland is look like this. Okay? Now, in the synthesis of this thyroid hormones, what happen in a plasma? There is a presence of iodine. The iodine is going to be entrapped, which causes oxidation of iodine. Due to oxidation of iodine, the free iodine is going to attach to amino acid, which form meta-iodine tyrosine and diiodotyrosine. That meta and diiodotyrosine, the short form is MIT-DIT. They are coupled to form T3 hormone and T4 hormone. In biosynthesis, this plasma iodine which is trapped and oxidation of iodine takes place, which causes iodination of tyrosine. Tyrosine is amino acid. To this tyrosine, the iodination takes place at meta position to yield the meta-iodotyrosine and diiodotyrosine. This is a meta-iodo, and diiodo means at these both meta position 2 iodo groups are attached. These both meta-iodo, diiodo are coupled to form T3 and T4 hormone, which are stored in thyroid gland and which are released blood and then in periphery to show the response. After response, there might be chances of the deiodination of this T3, T4 takes place, which yield the free iodine, and this free iodine again observed in our plasma, which is again going to trap, means this cycle is going to be continue, and which shows the thyroid action. Now, those drugs which initiate this release are the thyroids, and those inhibit the release of T3 and T4 by inhibiting this mechanism or interfering with this mechanism are the antithyroid drugs. Now, the thyroid drug which are used in treatment of hypothyroidism, in case of non-toxic goiter, in myxedema coma, also in cretinism. Cretinism means there is a hyperactivity, means the hyper growth of the physical mental hyper growth we can see, and then there is a chances of thyroid carcinoma. In its treatment, these thyroids are utilized. Now, thyroids in our syllabus, there are 2 main drugs are given in thyroids. L-thyroxine. L-thyroxine is nothing but the T4 itself. The structure is of T4, the thyroxine structure. It itself the hormone. The structure is, this is a basic nucleus, tyrosine, that amino acid, to its third and fifth position the iodine group, and fourth position para-hydroxyphenoxy group is attached. To its third and fifth position again the two iodine groups are present, means total 4 iodine molecules are present. So IUPAC name is at this fourth position 4,4-hydroxy 3,5-diiodophenyl, and then here again 3,5-diiodotyrosine. Now the drug which is given in dose of 0.05 to 2 microgram OD, means once a day by empty stomach, and the common uses of this both drug, the thyroxine and the L-thyronine. In structure of L-thyronine, the no one iodine group is present, but it is